Welcome to this explainer from My Sleep Scoring. Today we are diving straight into REM sleep behavior disorder, or RBD. We're going to be unraveling a truly fascinating biological mystery that happens in the absolute darkest hours of the night. And more importantly, we'll look at why catching this condition matters so much for your long-term health. To kick things off, I want you to consider a pretty wild but entirely true fact about human biology. Every single night, your brain intentionally paralyzes you. Seriously, it's a built-in safety switch. But what happens when that switch just fails? What goes down when the barrier between your vivid dream world and your actual physical body suddenly disappears? Let's start with Section 1, the mechanics of normal sleep. Okay, so you probably already know sleep is broadly divided into non-REM and REM sleep. Now, REM is where the magic and, honestly, the chaos happens. It's characterized by highly vivid dreaming, intense high-voltage brainwaves, rapidly darting eyes, and, this is the most important part for our mystery today, a complete suppression of muscle tone. So, the crucial point is that this critical muscle suppression is known scientifically as REM atonia. It is a completely normal and highly protective paralysis of your skeletal muscles. Think of it kind of like a physical mute button. It ensures that no matter how intensely you're fighting off ninjas or running a marathon in your dream, your physical body remains safely tucked in bed, totally still. Moving right along to Section 2, when sleep paralysis fails. In a healthy sleeper, your brainstem sends these inhibitory signals straight down your spinal cord to suppress your motor neurons. Specifically, areas in the pons and medulla are working hard to do this vital job. But in REM sleep behavior disorder, these very precise brainstem circuits malfunction. The normal, safe stillness of REM atonia just vanishes, and your muscle tone returns. Because that protective paralysis fails, the sleeper physically and often violently acts out their dreams. Now, to be absolutely clear here, RBD is not just harmlessly mumbling about groceries in your sleep, since the dreams associated with RGB are usually intense and action-packed, like being chased or attacked. The physical behaviors match that exact intensity. We are literally talking about shouting, swearing, punching, kicking, and wild defensive movements. That carries a very real risk of injury to the patient and whoever happens to be sharing their bed. So you might be thinking, wait, isn't this basically just sleepwalking? Actually, no, it's not. Sleepwalking and night terrors are non-REM parasomnias, and those usually happen earlier in the night. RBD is deeply tied specifically to REM sleep, which dominates the early morning hours. Plus, here's a huge clue. If you wake someone up during an RBD episode, they can usually tell you all about the intense dream they were just fighting through in incredibly vivid detail. Which brings us to Section 3. The neurological warning sign. Why do doctors care so much about this? Well, it's frequently a massive neurological warning sign. We generally drop this disorder into two main buckets. First is secondary RBD, which stems from a known issue, like a brainstem lesion or a specific medication. But the second bucket is idiopathic RBD, and this is where our medical mystery gets really deep. The term idiopathic is just a fancy way of saying there is absolutely no known cause at the time of diagnosis. Imagine a patient acting out violent dreams, yet their brain scans are totally clear and they aren't on any triggering medications. While a clear brain scan might sound like a relief, idiopathic RBD actually carries a huge long-term neurological risk. Research has revealed a staggering and honestly sobering connection. Idiopathic RBD is strongly associated with the future development of synucleinopathies. Specifically, we're talking about Parkinson's disease, dementia with Lewy bodies, and multiple system atrophy. A very significant percentage of these patients will eventually develop one of these severe disorders over the course of years or even decades. The sleep disorder is essentially acting as an early biomarker of neurodegeneration. Now let's take a breath, because it is absolutely vital to note that this doesn't mean every single patient with RBD is going to inevitably develop Parkinson's. However, proactive neurological follow-up is totally mandatory. Doctors are going to monitor closely for subtle early signs of neurodegeneration. Things like a sudden loss of smell, chronic constipation, minor motor slowing, or mild cognitive changes. Catching those signs early drastically shifts the entire care trajectory for the better. All right, let's look at Section 4, diagnosing the disorder. Clinical history alone, just sitting in a clinic, telling a doctor about these crazy dreams and the punching, that is not sufficient to officially diagnose RBD. The absolute gold standard test here is a formal sleep study, scientifically known as polysomnography. During this overnight study, doctors use sensors to carefully evaluate several specific things. They monitor REM sleep muscle tone, they use video to watch for physical behaviors, they check EMJ activity to track the electrical signals of the muscles, and they correlate the exact timing of all those behaviors directly to the patient's sleep stages. And this brilliantly illustrates how doctors confirm the diagnosis physiologically. During the study, they are looking for one definitive smoking gun, REM sleep without atonia. If a patient is clearly in REM sleep but the EMG monitors show spiking electrical activity instead of the normal flat line of paralysis, boom, they have physiological proof. Without this definitive study, doctors really can't distinguish RBD from other issues like severe sleep apnea or nocturnal seizures. Which leads us to Section 5, Safety and Treatment Options. Managing this condition follows a very structured protocol. Step 1 is always immediate physical safety. Because enacting these dreams can result in serious injuries like lacerations, heavy bruising, or literally diving out of bed, safety measures are absolutely critical. We're talking about patting the floor near the bed, lowering the bed height, taking sharp objects off the nightstands, and sometimes the bed partner might even need to sleep in a separate room. Only after the physical environment is completely safe do we move on to Step 2, medication, and Step 3, that long-term neurological monitoring we discussed earlier. Looking closely at Step 2, melatonin is frequently the preferred first-line therapy, simply because it has a much better overall side effect profile. The main alternative is clonazepam. Now, clonazepam is historically very effective, but it carries some pretty heavy baggage. It can cause daytime sedation and crucial balance and cognitive issues, especially in older adults. It's also super important to remember that while these treatments drastically reduce the frequency and severity of the episodes, they rarely eliminate the behaviors completely. There's also one unique scenario to consider. What if the RBD is actually medication-induced? Like we mentioned earlier, some cases of secondary RBD are triggered by certain drugs. Antidepressants like SSRIs and SNRIs are known culprits that can unmask or even worsen the symptoms. In these specific cases, a carefully supervised adjustment or discontinuation of that triggering drug might actually be the solution that resolves the whole issue.
Let's wrap up this explainer with our core takeaways. Normally, REM sleep features a protective muscle paralysis. In REM sleep behavior disorder, that crucial paralysis switch just fails, leading to vivid dreams being physically and sometimes violently acted out. You absolutely need an official sleep study to confirm that physiological loss of atonia. And while it is a very serious condition that might serve as an early biomarker for future neurological diseases, it is also highly treatable and highly manageable when you have the right safety precautions and medical care in place.
Which brings us to our final thought. The mystery of RBD shows us exactly how deeply interconnected our sleep architecture is with our overall brain health. We literally spend a third of our lives asleep, and what happens in the dark profoundly impacts our waking lives years or even decades down the line. So, since healthy sleep clearly protects brain health, are you truly paying attention to what happens when you close your eyes? Thank you so much for exploring this wild topic with me today. Stay curious and sleep well.